Well, I'm Dr. Darrin VanScoy, and we're here with Total Health Pros, Ascent Elite Health, and this is my partner, Lori.
Hi, Lori Wendell, nurse practitioner.
We just wanted to get on here and answer some questions we've been receiving from our patients in regards to some thyroid dysfunction. And so just to kind of give you guys some information and get it out there, we have a practice in Hurricane, West Virginia, 206 Chase Park. Our phone number is 304-382-2080. Lori's number is 681-781-9005. Or you can reach us at Total Health Pros on Instagram or Ascent Elite Health on Facebook. All right, Lori, so one of the questions we had was Renee asked, in Hurricane, is it safe to take Ozempic with an underactive thyroid?
That's a very good question, Renee, because, we look at patients every day with underactive thyroid, and you know that your metabolism is slowed. Your metabolic rate is slowed down at that point. So even if they're overweight, 40, 50 pounds or more, or if they're a person that actually is very healthy on how they eat very clean, and they're still 20 pounds overweight and cannot get that weight down. Over a year's time, you can increase that metabolic healing with Ozempic or the GLP-1s, and maybe weeks to months, up to 6 months, and that can increase that healing on the metabolic system, and can actually put you in a situation where you can actually eat more foods you've ever been allowed to eat on when you were trying to lose weight. Looking at that metabolic healing over less time is very helpful for weight loss and also healing of the thyroid.
So, yeah, and it's absolutely safe. A lot of the studies show it's beneficial to take Ozempic with thyroid dysfunction. One thing that I would, as a caveat though, there's some information out there, studies haven't been done long-term yet, in regards to the GLP-1s, GIP-1s, in regards to long-term use, greater than 6 months, with some possible negative effect on the thyroid. So it's one of those things as any medication, use it, get the effect from it, and then if you can get off of it as soon as possible, I'd really recommend that. Really, most patients don't see much benefit over 6-month usage anyway. And so if you've been dosed correctly, your diet's been modified, you're going to reach max benefit in that period of time as well. So really, Ozempic over 6 months, I wouldn't recommend it, but anytime under that with underactive thyroid, absolutely.
That's how we treat it, basically. We want to get you at your maximized dose on your GLP-1 quickly, as tolerated, and get you off of that in 6 months. In that 6-month time, we're revamping how you eat, looking at your diet, getting you cleaner on those things, getting rid of inflammatory foods. And that basically we're looking at a goal of 6 months because we know the studies that are there for that time frame, and we don't want to go past that. We try to keep it clinically appropriate with studies.
Okay.
Let's see. I'll ask this one, Darrin. Tammy from Beckley asks, my doctor has only tested for TSH. He says my thyroid's fine. Is there something else I need to look at as I feel I have all of the symptoms?
So we run into this on a really regular basis. We see patients all the time coming in and say, I feel like I've got thyroid dysfunction, some type of thyroid disease. I read, all the symptoms of it. I've got those, but my doctor says my labs are normal. When we start to investigate, the doctor literally has only checked TSH.
Correct.
And unfortunately, TSH is a pituitary hormone, not a thyroid hormone. So it doesn't really have a great indicator of what your thyroid's actually doing. So to answer your question, is there something else I need to look at? Absolutely. The actual functional thyroid hormones we need to look at are your total T3 and total T4, your free T3 and your free T4. And the reason why I said T3 first, it's actually the functional part of the thyroid. So the important things to really look at are your total T3 and your free T3. The T4 absolutely is an important part of it, but the actual functional part of the thyroid medication, thyroid function, is the T3. We look at those levels. Those are the important levels that we look at. And actually, even once we start treating you in follow-ups, typically all we look at is your free T3 and your free T4. The TSH doesn't really give an indicator of how those hormones are being produced, how they're interacting with the cell site receptors. And so, unless we look at those and we look at a couple other indicators like reverse T3 or T3 uptake, we don't really have a good picture, nor does your doctor have a good picture of whether or not you actually have thyroid dysfunction or not. So in regards to blood work, you want to make sure if somebody's looking at your thyroid and its function, you need to have a TSH, you need to have T4 total, T3 total, free T3 and free T4 done. Those are the 5 basic ones. Other than that, to take a real deep dive, there's other tests that I'd mentioned, but we can talk about that probably in another question. I'm sure it will come up.
As a caveat to that, when you looking at TSH, if they do look at that only, if you are not between 1 and 2, if you are above 2 on a TSH, your pituitary is working too hard to get your thyroid to do what it needs to do. So basically, anybody who has a TSH, even if they're above 2, if they're at 3 or 4, they're having thyroid symptoms. I don't care what's going on somewhere down the line. Even if the T3 and T4 are in normal levels, free T3, T4, when we look at those, they're normal. We can get those maximized to a better functional level and get you higher normal, because I guarantee you, if your TSH is higher than what we're talking about, you are suffering from thyroid symptoms, underactive thyroid, somewhere down the line where we're going to find it.
Yeah. And unfortunately, most people go around 10 years. All the studies are showing go around 10 years before they're correctly diagnosed with thyroid dysfunction. So it's one of those things you definitely need to get checked out. If your doctor's just running TSH, ask them to do these other tests. If they won't, find a different doctor. Okay. Laura, I got another question for you. It came in from Trina from Point Pleasant. I went to my physician and had blood work done. It seems that I have all the symptoms of thyroid issues. He says my T3 level is fine. How can this be if I feel I have all the symptoms of thyroid?
We kind of touched on that just now. And my hemoglobin can be like 11, and if that's the normal range for that, I'm still normal, but I probably still have some issues. Probably have an iron deficiency issue or a vitamin B level that's inappropriate. There's reasons for anemia, but same thing with thyroid. You're going to suffer from symptoms if you're in the lower level of normal. As I mentioned, functionally, we want to get you in the highest functional level for you that makes you feel better. So we do base our decisions on the numbers. And again, we look at those levels. If they're low normal and you're having the symptoms of fatigue and all these things that are definitely thyroid related, we're going to bump that level up and get you treated in a level that's actually higher normal until we get to where you feel better. And when you get to that place, that's your sweet spot. Yeah. We're going to look at that.
Well, the other thing that a lot of doctors don't test for is reverse T3 and T3 uptake. And so those actually measure. So reverse T3 is the actual byproduct of thyroid modulation within the liver. So occasionally your body will make T3 opposite of the way it needs to go into the receptor site. So it's basically like saying that I have a right-handed glove, and a right-hand glove will fit on it great, right? But if I have a right hand and I try to take a left-handed glove and put on it, it's reversed. It won't fit correctly. And so occasionally your body will increase reverse T3, meaning the fact that it is reversed. It's built backwards and it can't fit into the receptor site. So you can have normal levels of T3, but unfortunately the T3 is being built wrong and it can't literally dock into the receptor site to cause the actual action at the cell. So if your doctor's not looking at that, you very well could have some thyroid issues, even though your T3 levels are normal or even high normal, because literally your body is making T3 shaped incorrectly and it can't get into the cell to cause the interaction that it needs to. The other thing too, for other reasons, inflammatory responses, several other things, your T3 uptake, meaning the fact that your body's ability to take T3 from the bloodstream as it's circulating, pull it out of there and utilize it, can be diminished for a number of reasons. Could be diet, could be other medical issues, could be other hormonal imbalances. So if your T3 uptake is low, then even though you have normal T3 levels, you may not have actual proper thyroid function. Again, that's something that we look at. We take a very deep dive when we look at these issues with the thyroid because it's very complex. So these are other issues that you can talk with your doctor. And if they don't really have much information or they don't seem like they're willing to help you, please give us a call.
Okay, Darrin, we'll go to another question here. There's Paul from Barbersville. He said, I've read that my diet can impact my thyroid function. Is this true?
So absolutely. Thyroid, especially women, because of the estrogen dominance with women, thyroid is especially susceptible to chemical compounds, things within our foods, right? So one thing that can affect thyroid function is soy. Soy is a phytoestrogen. Phytoestrogens can impact thyroid dysfunction and actually decrease it. We see that some with males. We're seeing it more as males come in and having more thyroid function with men, but typically we see that with women. The other thing that we can see is like cruciferous vegetables can have a big impact on thyroid function. If you have an underactive thyroid or a poorly functioning thyroid, and you're eating a lot of cruciferous vegetables, i.e. cabbage, kale, broccoli, Brussels sprouts, those, because they have a chemical compound called phthalate in it and oxidates in them, they can actually decrease thyroid function. So cruciferous vegetables. The other thing that we can look at is if you have a diet high in nightshade vegetables. So that would be your peppers, your potatoes, eggplant, those types of things. They can have a negative impact on thyroid function as well. So, there's lots of foods we have in our diet that seem to be healthy that can impact our thyroid if you're symptomatic or even if you're not symptomatic, but you've got decreased thyroid function for whatever reason. Other things in the diet, sugar, major issue with thyroid, causes inflammatory function. Fried foods, animal fat that we have high in our diet, vegetable oil, seed oils can cause issues with thyroid function because of inflammation. The more foods that you have in your diet that provoke an inflammatory response, the more likelihood you are to have thyroid dysfunction or thyroid decreased function because of the inflammation present within your body.
That's correct. And that pretty much answers the next question from Danny from Scott Depot. He was asking what foods specifically can flare up my thyroid issues. And it would be those foods listed there.
Yeah, specifically like cruciferous vegetables can definitely do it. Some patients, especially with really low thyroid, again, nightshade vegetables can have a big impact on your ability of your thyroid to function correctly. Soy is a big one. And soy is just, we tell this to our patients all the time. Soy is in everything. I mean, soybean oil, soy protein, soy lecithin. Soy can have a big impact, highly genetically modified, which then, because that promotes the inflammatory response as well. So soy is one of those things we just recommend if you've got any kind of thyroid issues at all, you want to try to get that out of your diet completely.
That's something as a side note, caveat to the diet, being that I found my own thyroid issues, my TSH was normal below 2, but actually below 1. But I used to eat green peppers. I used to eat all these almost every single day. It was in my food prep. Since that time, I do not use green peppers. I have not probably had green peppers in 6 months. I just totally have ruled that out of my diet, and I definitely have cut the foods out that are inflammatory to me.
So really, I mean, basically, the cleaner you eat, the more that you prep your food, the more that you buy organic, the more that you buy non-GMO, the more that you buy non-boxed food, the healthier you are in general, but definitely the better off your thyroid is for that. So we got another question. Jenny from Nitro says, a friend told me that thyroid dysfunction can cause poor sleep. Is this true? What do you think about that, Lori?
Absolutely. That's one of the things that I couldn't figure out with myself. Why can't I sleep? And a lot of times we'll go to sleep. We'll wake up at 2 o'clock in the morning and be awake for a couple of hours, if not for an hour. Definitely, that's a sign of hypothyroidism.
Absolutely.
It's one of those things you just can't. You think it's just normal. Oh God, I'm getting older. This is just crazy. But once my thyroid was corrected, when I go to sleep, I am asleep, at least 5 hours, 4 or 5 hours, which is my typical sleep. Not enough, but that's my typical sleep. I'm gonna let you go more into detail.
Well, my wife is a perfect example as well. She had a terrible sleep pattern for a long time. Till we actually found out it was her thyroid dysfunction that was causing problems, and got her on medication. She didn't sleep well, didn't sleep, deeply at all. Now that she's on thyroid medication, the house could be burning down and she could still sleep. Like it's almost dangerous. But it was actually getting her thyroid functioning properly that made the biggest difference in the world in her sleep patterns. And she'll be the first to tell that was kind of the biggest change in her health as well too, as far as her energy levels. Her ability to focus. She struggled for a long time because she just wasn't sleeping well. So the thyroid medication, treating the thyroid dysfunction, really changed her outlook, ability to function, especially in the afternoon. She wasn't getting that 2 to 3 o'clock where she was just like drowsing, dozing off, trying to fall asleep. And so it's made a massive difference in her life. So absolutely, if you've got sleep issues, as far as getting to sleep, staying to sleep, that could easily be a thyroid problem. Get it checked out. Absolutely.
All right, we'll go to this next one. This is from Sarah in Parkersburg. Armour Thyroid is what I take, actually. My doctor told me that Armour Thyroid, even though way more natural, is dirty. What does she mean by that?
So,
it's kind
of, this is a pet peeve of mine. So, unfortunately, a lot of the information that doctors have on medication is brought into them by drug reps, right? And so drug reps obviously want to sell their drug more than the other drugs that are out on the market. And this has been a big misnomer out there for so long about Armour Thyroid, Nature Thyroid, Wellthroid. All of these medications are the natural forms. They're actually taken from glandulars from either pig or cow, equine or bovine glandulars. And so a lot of doctors, because they've been told by drug reps coming in marketing Synthroid and some of these other big name thyroid medications, they've been told, well, those are dirty. That's absolutely not the case whatsoever. Armour Thyroid's been around for 30 years. So that tells you, one, it's safe. And two, it tells you it's effective. And it's not expensive. They don't do much marketing for it. But Synthroid and some of these other medications put tons of marketing every year into it. And this is one of the big things they put, it's from a glandular. You don't know the source. You can't trust it. Absolute bonkers. So many medications come from natural sources that, they don't bring those up. Most of our medications are plant-derived, animal-derived in some way or another. Some are purely chemical. But either way, those are clean, they're purified before they're put into medication form. These are pharmaceutical grade products that we're talking about. It's one of the most ridiculous things I've ever heard come out of somebody, but I actually heard doctors say that myself. So, Synthroid, they assume, I guess, because it's made in a lab, that we chemically put it together, that somehow that it's cleaner than, natural thyroid hormone, but that's not the case whatsoever. And really it is. So Armour Thyroid is way more natural. There's other brands, like I said, Nature Throid, Well Throid, but it definitely is more natural. It has the different split of hormones. So when you're looking at Armour Thyroid, it has both T4 and T3 in it. So it allows your body to utilize those in a better way as it needs, as opposed to Synthroid, which just has T4. The problem with that is if your body can't convert T4 into T3, the functional form of thyroid, you don't have medication that's going to work for you. And we see that all the time.
That's
Patients
true.
coming in with thyroid dysfunction going, I'm on medication, I don't feel any better.
It doesn't work.
And it doesn't work. And so, Lori, you can address that too.
And that's the whole issue there. A lot of times, and I came straight from medicine. I'm a nurse practitioner, work cardiology. I work family practice. That's what my certification is in. But, they give you this, they almost give you fear mongering when it comes to thyroid treatment. You only want to look at TSH and treat T4. Because, if you give people liothyronine or Cytomel or Armour Thyroid that has T3 in that medication, you're going to cause a stroke. You're going to cause these patients to have a heart attack. They're going to have a stroke. Any medicine that you over-medicate someone with is going to cause a problem. T3, these levels with our clinic are monitored very closely. This is what you have to do. To treat the thyroid appropriately, you have to treat it with T4 and T3 a lot of the time.
Absolutely.
Again, you're giving someone T4, which is Synthroid, which is what you're going to get from your regular doctor. If it doesn't convert, once it comes out of the thyroid, it's not doing its job. It might give you a higher T4 level, but it's not working on the T3, which is the one that is the
see that all the time, yeah.
So, I think that's part of that too. Maybe it's just not marketed and by the pharmaceutical reps and so forth, and they feel like it's dirty. But I think a lot of the times it's because it has T3 in it, and they're afraid to use it. And it's okay. That's the way I was taught. But you just have to step outside the box and you have to look at the patient. What are their symptoms? What is working for that patient? And then we just monitor it closely and get them to the sweet spot, and then you're done. And we see it happening all the time. These people are walking in, my God, thank you so much. Somebody finally listened to me. I've been on this medicine. It's not worked. Now I feel great. So definitely, I think there's a lot of caveats to that question.
Well, a lot of it comes down to treating the thyroid is a big puzzle, right? And a lot of doctors simply, to give them credit, just do not have time to look at it in depth, right? And it does take in-depth look. If you've been on medication and you're still having signs, symptoms, complaints, the medication's not working for you, or it's not dosed correctly. Either way, your doctor needs to be listening to that. But the problem is they just don't have time to really take a really good in-depth dive and take a look at all of these. We've talked about 7, 8 markers already that if you're treating thyroid, you really need to look at. And so to give them some credit, sometimes they have to see so many patients with some other more serious issues, that are absolutely life-threatening sometimes at the time, infections, whatnot, that they just don't have the time to put in to look at thyroid like they should. So it's one of those things, you've got to be your own advocate in regards to if you've got issues and you really believe that those need to be treated, they're not being addressed. You really need to be, gentle, be nice about it, but be forceful with your doctor. These are issues that aren't being addressed and you're not happy, and ask more questions and get answers. And if they don't, then just find somebody else that will provide those answers for you. So we got a question that came in. It said, I read that eggs can be beneficial for thyroid dysfunction. What are your thoughts? And that was from Lexi from St. Albans.
Yeah, and that's Darrin's forte. He's the nutritionist, but definitely there's vitamin D in eggs.
Vitamin D,
iodine,
and selenium.
Selenium is a trace element that is essential for your thyroid function. So, of course, we can speak heavily on eggs. We eat them every single day. Eggs are healthy for you. Protein. You've got everything in that egg. So
and even
definitely,
if you've got cholesterol issues, eggs are still okay to eat.
Correct.
So, the big thing, though, with that is that selenium is one of the when we specifically test for selenium, that's how important it is. It is a trace mineral, but it has an impact on so many different types of hormonal balances within the body, specifically thyroid function. So, the selenium from the eggs is very important. Vitamin D is important in everything that we look at in regards to, there's not a single cell in your body that doesn't have a receptor site for vitamin D. Eggs have a good bit of vitamin D in them, so they're a great food. So yeah, it's one of those things that eat eggs. It's going to help your thyroid. Definitely not going to hurt it. It's going to improve your thyroid function. That being said, if you've got low hormonal balance, if your thyroid's dysfunctioning, you might be able to eat a ton of eggs. It's not going to matter because you've got other issues in the downstream problems with the thyroid. So still get it checked out. But if you're on thyroid medication, eggs are just going to make it better.
This is something he mentioned, cholesterol. I'm going to just throw in here. This is for another day to discuss.
Whole nother discussion. Yeah.
But I will say this. Sometimes when your thyroid is underactive, you will start out showing signs of a little bit of an elevated LDL cholesterol. And sometimes and there's certain factors that are going to show up first. And you have underlying thyroid problem, and they're not going to want to look at that any deeper than TSH.
Yeah. So,
you may have an underlying hypothyroid issue that needs to be looked at prior to starting on a statin. Trust me, I'm a cardiac nurse practitioner, but sometimes that's not the problem. You need to treat something underlying that can treat that cholesterol, and it will improve with thyroid function.
Yeah. I mean, it typically, LDL issues typically are some type of liver modulation problem. Absolutely, though, if you've got a significant thyroid function problem, it can be causing those LDLs by themselves to be up. Nothing else. You could have everything else in check, everything else working well, but your thyroid's dysfunctioning, your T3 is not modulating well, and you've got an LDL or a cholesterol problem, and it's literally due to the thyroid. So again, this is a problem that's very deep. It's very complex. Doctors a lot of times just don't have time to look at it. They don't really want to listen to it. They don't really sometimes even have a knowledge base for these deeper tests that we're talking about. So it's definitely something you need to bring up with them, read. But the other thing is get educated about it, right?
Absolutely.
Read on your own. Read about thyroid dysfunction. And so that would be something that would be very beneficial to you and your own health. If you suspect you have these issues, start looking into it, ask questions. If your doctor doesn't want to answer them, doesn't have time, absolutely contact us. So one question we got from Bill and Cloden, are thyroid issues chronic, and can they be reversed and cured?
That's an excellent question.
Yeah, it absolutely is.
Because you have different types of thyroid dysfunction. Example being my diagnosis. My thyroid is just not functioning well. We do the test we talked about here, but we sometimes have to look at another situation called Hashimoto's, hypothyroidism, and even hyperthyroidism for that matter. But we look at your TPO antibodies, thyroid antibodies. If those are elevated, you can have what's called Hashimoto's. That's caused by an autoimmune issue. Your body's attacking the thyroid, and there's inflammatory processes going on in your body. So if we can get those inflammatory processes taken care of, get them decreased, get the TPO antibodies and thyroid antibodies down back to normal levels, your thyroid can function normal again. That's a process of going through supplementation. Currently, you need to use thyroid medication to get through this situation, but once we get that Hashimoto's under control, yes, that can be cured where you can stop taking your thyroid replacement medication.
Yeah, and we've had patients just by supplementation and correcting diet, they went from underactive thyroid to normal thyroid without medication whatsoever. The diet is the key there. If you've got a diet high in inflammatory modulators, high in inflammatory proteins, foods, those types of things, then if that could absolutely be one of the big causes of your thyroid dysfunction. So, supplements, diet can absolutely do a tremendous amount in getting that thyroid functioning properly without even having to be medicated. Again, as Lori mentioned, if you've got thyroid globulin issues, the TPO issues are elevated, autoimmune is almost always an inflammatory response to some level. Can be response to food, can be response to chemicals in the environment, can be response to medications that you're on. And so it's one of those things that, if you've got autoimmune issues, if you've got Hashimoto's, any of these issues, we definitely need to take a good look at the diet. That's all inclusive. We do that on a regular basis because of the inflammatory component.
Well, gosh, Darrin, have we gotten all the questions?
We got a couple more here. I think that so Taylor Taze Valley said, what are some of the possible side effects of the medication for thyroid diseases? I'll let you take that one, Lauren.
Okay, what I talk with patients about is thyroid definitely, you understand your metabolism is a little slower. A lot of times our temperatures are lower.
A lot slower sometimes. Yeah.
A lot lower. My temperature used to run, I've taken my temperature in the office and Darrin will say, there's something wrong with that thermometer, but he takes his temperature and it's fine. Sometimes 97 degrees in temperature. These things are underactive thyroid.
Yes.
Starting on the medication, your heart rates can be lower. When you get that T3 that's active and you get that increase in that, it can cause maybe a little anxiety. It can cause maybe some palpitations, but these are the reasons why we start these patients very low, because we want to get them used to the introduction of more active thyroid into the body. That's typically what we would see, and we don't normally see that with people because we start lower. especially if you're extremely low on your T3, free T3, and I put you on Cytomel. Sometimes I've been a little more lenient and gone up a little higher than what I think maybe I should, but they're so low. I had one patient. She started getting a little anxious, had a few little palpitations. We backed her off 5 milligrams on that, micrograms on that, and she did great. I've put people on 15. They've done great. It's just, that's why we try to usually start low on medications and move them out. Now, as far as Synthroid goes or your T4, that doesn't typically cause as much of an issue because it's more more time needed for that T4 to get released and actually cleave off and become T3. Again, as Darrin mentioned earlier, if you have a T3, if you have a problem where you're not having an uptake that's low, or you have reverse T3 that's high, that's not going to work for you anyway. So that's why the continual monitoring of labs. And sometimes if I put a person on a T3, I check their labs in 2 weeks. I don't wait 8 weeks. I want to see where it's going. Okay, it's time to bump you up more. We don't want to take so much time. 8 weeks for Synthroid might work for people, but it's not going to work on T3. In Armor, we've got to check you more frequently and get you
that's our
correct
typical
dosing.
protocol.
Yes.
If we start you on any type of thyroid medication, we're going to check your blood work again in 2 weeks, right? And then we're going to adjust that medication depending on what your symptoms are and how you're feeling. We may typically we'll increase it about every 2 weeks till we get you to a functioning level till you say, man, I feel great, and then we go by that. But, we're going to check it every 2 weeks. And that way we can increase it, decrease it as appropriate. And as the patient is responding. So, that's one of those things that, thyroid is not one of those things you just start on medication and you're done. And if you've been on the same dosage for a long time, you need to have your blood work checked because, especially if you're still having issues, because you can go on it for a long period of time. Environmental factors can change, your body physiology can change, and you may need to have your dosage adjusted. So, it's definitely one of those things that you can see issues with it, but because we start out so low and we work up and we test every 2 weeks, we seldom ever see that.
Correct.
The one thing I will say though that as a caveat, I'm a pro bodybuilder. Lori's training; she competes as well. Constantly in our field, we're seeing trainers, people that are not qualified, have no business suggesting medications to their clients. We see it constantly. Trainers telling their clients, "You need to go on T3 to lose fat." It's the dumbest thing you can do on the planet. It's kind of a little soapbox of mine. It really gets me agitated. People don't understand if you don't need thyroid medication and you start taking it, it can permanently damage that monitoring system, right? And so you could have perfectly healthy thyroid. You go, man, I want to lose weight faster. You start on thyroid, you've permanently damaged your thyroid, and you're on medication forever to take care of that. It is the dumbest thing. It's one of those things that agitates the crap out of me, and the fact that we've got unqualified people suggesting and telling their clients, you need to do this. This is how you get it. This is where you can get a hold of it. Take this and it's going to help you burn fat faster. Yes, it will. I won't argue with that. You're also going to cook muscle off too. If you don't need to be on thyroid and you're taking thyroid medications for weight loss, for focus, whatever, it's going to cause you to lose muscle mass. There's other issues. It can cause heart arrhythmias. It can throw off growth hormone, because it can have a major effect on your pituitary gland, right? And so it can throw that pituitary axis off that monitors everything. And so one dose of T3 when you don't need it, or Synthroid when you don't need it, can permanently affect the rest of your life. So if if you're training, if you're competing, and then you've got a trainer that suggests this, you need to run because they're not a good trainer. They haven't planned your protocol out well enough. They haven't planned your diet out well enough. They've got into crunch time and they're trying to make up for it. You just don't have a good trainer. If you have to resort to T3 to get to this, to get to those levels, you need to run, find a different trainer.
I'm going to be straight out honest with this. This is how I met Darrin. I was training for a bodybuilding show, I guess, 2.5 years ago. I'm a nurse practitioner. I know these things, but I'm trying to lose weight and get more lean for my show. And I took the advice of my trainer to take T3. Is that why mine is not functioning at this current time? I have a long-standing history of hypothyroidism in my family. Maybe it was already there. However, I took that T3 and I went to him to have some work done on my hip. He's a chiropractor, as you know. He says, "What are you taking? What are you doing?" That's my first encounter with Darrin. I tell him what I'm taking because I'm straight out honest. He says, "You need to go to the health food store," and he gave me 3 different things to purchase that day to get this stopped. He says, "You shouldn't be taking that T3." Absolutely. We use ourselves as examples.
Yeah, all the time.
All the time, and I'm just putting it out there. I did that. I will never do it again. I'll never take that again. Obviously, I'm on the medicine just to keep myself normal. So heed that warning, please. If they tell you you need to take it, run.
Absolutely. Agree with 100%. So we got another question that came in. Dale from Hurricane asked, which we kind of covered a little bit already, what's the difference in TSH, T3, T4 testing? Should we have them all? he wanted to know. And, kind of covered that. It really kind of is patient specific, really, I would say. The basis for sure, TSH, free T3, free T4, total T3, total T4.
Absolutely.
Those are the basics. If your doctor's just testing TSH, they're not really looking at your thyroid function. It's a best guess at best, really. And so, those are going to be the things really those are the minimum. Then if you really want to take a deep dive, you're going to be looking at your TPO, your TGAB, thyroid globulin antibodies, thyroid peroxidase, reverse T3, T3 uptake. Those are the next 4 basic ones, and I would say that we would look at, right?
Yes.
But again, we're not going to necessarily just jump into those. Again, testing can be expensive. I say all the time, I try not to spend other people's money. I'm really good at spending mine, but I try not to spend other people's money. So, those are some, you start with the basics. Then when you get results back from that, or if you're somebody, for instance, that does have history of thyroid problems, you're not responding to medication, we're going to run it all. All of those 7 or 8 tests need to be done. But from the basics, really, TSH, free T3, free T4, total T3, total T4, you can get a great picture of your thyroid from those.
I agree totally. There's no addition to that. Basically with anybody, especially men, we're seeing more of a thyroid issue in men than used to ever be. So we do run the basic for those guys, and then sometimes if we see an issue, then we will run further deep. We don't like to, we try to watch your money, with lab results, but we try to start at the basis and move out from there depending on the values. So,
my phone went off in the beginning of this because somebody had texted in. Tamara from Mineral Wells asked it. A friend of mine suffered from thyroid dysfunction for a long period of time without much intervention from her doctor. She started a very clean keto diet, and she says after 6 months, her thyroid levels are much more normal and she feels better without medication. Is this possible? Or you want to address it?
Yes, it is, because you've taken out
Absolutely.
these inflammatory foods. You've eaten clean. Again, like we do supplementation with selenium if they need that. And just as a brief note, you can get what you need in selenium by eating two Brazil nuts a day.
Yep, that's it. That's
all you need. So definitely a change in the diet can make a difference, because we've seen that happen with turmeric, curcumin. We add those things when people have the inflammatory response going on.
Yeah. And so, I'm not saying necessarily that going on the keto diet is going to fix your thyroid problems. Can it have a positive impact? Absolutely. We've seen this over and over again. When you eat a clean keto diet, not dirty keto, I mean dirty keto being sausage, bacon, all these other things. When you eat a clean keto diet with all the good fats, the good meats, those types of things, you decrease your carbohydrates, which means you're decreasing your sugars, you're decreasing your junky carbs, you're decreasing the boxed foods, those types of things, and you're eating way more natural. You have a lot less inflammatory mediators being presented to the body, which is going to cause a lot less problems because you don't have the inflammation present. All of a sudden your thyroid can start functioning. Like we said in the very beginning, thyroid is very susceptible to inflammatory markers, inflammatory mediators. That seems to be, thyroid's almost an indicator that you've got inflammation in your body. If you've got a lot of inflammation, your thyroid's going to be one of the first organs affected significantly. So, we're not saying that keto diet is going to heal thyroid issues, but can it have a big impact? Can it absolutely make it function way better without medication? Absolutely. So, diet, again, like we said over and over again, diet is key, is really paramount in overall level of health, whether it be hormones, thyroid, whether it be progesterone, estrogen, testosterone balances, liver function, whatever. The foods that you eat have a massive impact on your overall level of health. We've really been talking about thyroid here. So yes, absolutely foods can have a major impact. Keto diet, clean keto diet can have a big impact. But there's a lot of others. It's another topic for another day as far as liver function. Yeah.
And I will say this, it's one of those things. People want to fix. They want a pill to fix it. They want, that's what we're taught. Oh, you got this, you're anxious. Let's give you this medicine. You have this, let's give this medicine to you. But it is actually going to take a person being responsible for the food they take in. You have to take responsibility for that. That's the only way you're going to heal yourself.
Yep.
Is to eat appropriately. And it's a process. We don't expect you to do that flip-flop and do it tomorrow, but you incrementally change your diet and you will feel better. It's just one of those things. We'll work with you for that. We're not going to send you out there alone, but it takes a person. You have to want it. Just like anything, you have to have the desire.
Good health takes action. Yes.
It takes action, because you can sit back and you can eat all that you want and not pay for the good food now, but you pay for your health later. It's one of those things you just have to take the realization that I've got to take care of myself.
Yeah. So, if that's one of those questions, hey, how do I eat clean? That's one of the things you contact us about. Again, Total Health Pros on Instagram, Ascent Elite Health on Facebook. Contact us via our phone numbers. But that's going to be one of those things. If you don't know where to start and you suspect you have thyroid issues, thyroid dysfunction, absolutely get a hold of us. Please ask those questions. That's what we're here for. That's what we love to do. We love these hard puzzle pieces that we've got to try to
We
put
love
together.
puzzles.
And we get those every day, constantly. So, if you've got questions about that, please hit us up. Again, I'm Dr. Darrin VanScoy.
Lori Wendell, nurse practitioner. And we gave her numbers in the beginning. We
Yeah,
probably
but
should give
with
them
that
again.
again, you can contact us at 304-382-2080. Lori's number on her cell phone, 681-781-9005. And again, hit us up on Facebook.
We'd love to hear from you.
Yeah, we'd love to have a conversation about how we can help. Guys, we really appreciate your time today. Thanks for watching. Have a great day.
Bye.